Welcome to today's episode where we're going to talk about all of the things regarding hip diagnosis. And I'm Brandis Montgomery, doctor of physical therapy and owner of On the Move Massage and Physical Therapy, and I will jump right in and get started. So today, again, we're going to talk about the hip. There are lots of diagnoses of the hip that can often be scary, especially if you have a physician that tells you your diagnosis but doesn't give you a lot of information about it. And those diagnoses mostly don't need to be frightening to anyone. So we are going to discuss a few of the more common ones today. First, a little anatomy lesson about the hip. The hip is a ball and socket joint, so we have our long leg bone, which is called your femur, and a socket that sits around that, which is our hip bone. And it really allows our hip to move in all planes. So it can do circles if we want, go forward, back, side to side, and it allows a lot of motion there. However, in order to keep the hip stable and in place, we have a lot of muscles that also are surrounding that hip. And the hip muscles are typically pretty large muscles, although we do have lots of little stabilizing muscles deeper in there. And those muscles are just as important in providing stability there. But that's why you don't commonly see the hip dislocate in the average individual, because we do have so many big muscles around there that provide the hip with support. And those are so important in treatment and preventing injuries at the hip. So we'll discuss them a little bit more as we go forward. The first thing we're going to talk about today are the strains and tears. So a strain is a version of a tear. A tear is a full strain, if you want to look at it that way. So you can have different levels of a strain, and which goes all the way up to a full tear. And this can involve a muscle, mostly is what we're talking about here, tendons, where a muscle is inserted into a bone. That's the tendon that does that. And those tendons can tear, muscle fibers can tear, and that's called a strain. So this typically happens if we're doing something more energetic, even something like climbing a lot of stairs, especially if we're not used to it, we can strain a muscle. Or maybe we're moving or just finished moving and we were doing a lot of like lifting and squatting and we're not used to those types of activities. We can strain muscles. But most commonly you're going to find hip strains in athletics and sporting events. So we can typically... The tendons that you're going to find are most strained are the hamstring and the adductor muscles. The hamstring is the tendons that are behind our hip, the thigh, and come up and insert into our hip. And the adductors are the muscles along the inside of our thigh, which come up to the inside of our hip. And again, those are commonly bothered by sports and energetic, more stressful, strenuous activities. And we treat these strains and tears with eccentric muscle strengthening, and along with other things. But this is the most common way and most researched way to provide strength to the muscle while it is lengthening. So a concentric strength, which is what most people would know of when you just go to the gym and use any machine there, you're doing concentric strengthening where your muscle is shortening, it's getting shorter, and it's getting stronger. And in eccentric strength, your muscle is lengthening, so we're not like bending, we're extending, for example. And as those muscles are lengthening, they're getting stronger, working them through that range of motion. So this is the best thing that we can do for a strain especially as we rehab through all the beginning stages of pain and stretching and pain control. Once we get towards more sport-specific activities, we definitely want to start incorporating eccentric strengthening. And then the second most important thing that we can do is not only just strengthening these muscles around the hip, but making sure that the individual knows how to contract these muscles in order to use them to protect the hip. For example, most commonly unknown muscle that we have are our glutes, and that's your buttock muscles. There's several of them. And when we don't know how to turn our butt muscles on, they can't help us. However, they do generate a ton of power. So if we know how to use those muscles, we can really increase our power output. So learning how to turn those muscles on for your sport is very important. Okay, next we're going to talk about labral tears, which sounds super scary. They're very common. Research shows that there was a specific article I read, I want to say it had 70 subjects, and a third of these people had labral tears on scans, and they had no symptoms. So labral tear sounds very scary, especially if a doctor talks to you about surgery for the labral repair. However, labral tears are very common, and people walk around with them all day, every day. So don't let that frighten you. You can get through life without surgery. You can return to your sport. You can be very functional and get around life without fixing it. If you want a quick fix, of course, surgery is going to be quicker than trying to rehab it. And they go in and they repair the tear, but then you have lots of restrictions after for a little while, and then of course rehab following to get back to your sport. So my first recommendation is always to try physical therapy first, and then if you're not getting the results that you want, say in 6 or 8 weeks of physical therapy, then you go back to the surgeon and discuss surgery if that's the route you want to take. But again, we go back to this idea of strengthening our muscles that support our hip. The labrum is inside of this socket joint, so it sits in here so that our bone doesn't crush into our other bone. And so if we get a little tear there, sometimes it can feel like it gets caught, like your hip gets stuck. Squatting, kneeling, deep kneeling, pivoting sometimes can be painful. Stairs can be painful sometimes. So it's more of extreme hip motions that cause discomfort there. And if you learn how to use the muscles that stabilize around that joint so that they're not compressing on the labrum all the time, then you can find relief that way. So your rehab focus for a labral tear is strengthening and learning how to use those muscles to protect the joint. Make sure that it doesn't continue to press where the tear is located. And then lastly, we're going to touch on tendonitis, bursitis. Again, can sound very scary if you don't understand what that means, but anything with an itis is inflammation of. So tendonitis, inflammation of a tendon. Bursitis, inflammation of a bursa. A bursa is just a little jelly-filled sac that are typically found near muscles that protect them and keep them from creating friction. So sometimes if that tendon rubs on the bursa an incorrect way or too much, then we can inflame the bursa and it becomes painful. Same thing with a tendon. If we don't use the tendon correctly or we use it in a way that it's just not used to doing, we can cause the tendon to become inflamed. And the number one treatment for tendonitis and bursitis would definitely be physical therapy. Occasionally, I will recommend someone gets a cortisone injection in conjunction with their physical therapy if they're not tolerating well, so that the cortisone can decrease the inflammation for the time being while we're working on making sure the inflammation doesn't come back. Those injections can give you some great relief, but they're not solving the problem as to why you had the pain to begin with. So there's a good chance in your future that pain could come back. So I recommend doing them in conjunction with physical therapy so you can continue working with the physical therapist to find out why your tendons are becoming inflamed and solve that problem so that going forward you're in a good place and know what to do to take care of it. So PT is definitely the key for hip pain, as you can see. I never recommend surgery first for hip pain if someone comes to me with it. And oftentimes hip pain can be a referred pain from your low back, or your sacrum, and it's oftentimes mixed kind of together with like arthritis or something like that. So a physical therapist can help you determine which one of those it is. Is it coming from your spine and your nerves, or is it coming directly from your hip and the tendons and or muscles or whatever around that area? So determining the cause is the most important part first, and then you'll know we can go forward with the treatment plan. So please reach out to me if you've got questions. You can always comment below the video, or you can reach out to me on my website, which is on the bio page anyway. So I hope everyone learned something. Make sure you join us in 2 weeks, week after next, and we will jump into some more cool body parts and talk about how we treat them. Talk to everyone soon.